anatomy, physiology also, that is what is abnormal firing of the impulses. So go through it, and you can have just what basic idea about what epilepsy or what seizure or what convulsion is, because these are the synonymous terms which are used for this. Let us go for one after another. So what seizure is? It is a sudden brief disruption of a normal functioning of neuron in the brain. If you know that neurons are functioning in a very synchronous manner, one after other, this synchrony is very, very important for functioning. Very simplest example of synchrony is what's a reflex or a simple reflex you people have studied, or simple thing is I'm asking a question that goes to your brain. That is, first you listen it, you try to understand, then you try to find answer and you reply, then again every machinery is, that is sensory, motor, association, what we three important portion we discuss. All these three are activated, and accordingly you answer, you reply, and again either the muscle of the oral cavity for speaking, or if I ask question, then for hand muscles for writing. All these muscles are activated, and they do it in that way. So this is how this system is working. This is very synchronous, one after other. But when this synchrony is lost, when there is asynchrony, then and there is a rapid firing, then the problem is there. So there is a brief disruption in that. Now what can be signs of that? It can appear like a sudden cry and fall. It can be followed by convulsive movements. Now what do you mean by convulsive movements? Because we call them as a tonic and clonic. Tonic means when the muscle tone is increased too much. Clonic means there is a loss of muscle tone. So tonic is a sort of body shrinking towards trunk. All the limbs, the person has fallen, and all the limbs are restricted, or they are squeezed towards the trunk, and then all of a sudden there will be relaxation. So again all this will go back to the position. So this type of jerky movement is there. We call it as a convulsive movements. It will be there of limb. Shallow or interrupted breathing, it can be there. Why shallow or interrupted breathing? Why breathing will interrupt? Because breathing is done through skeletal muscle, diaphragm and the intercostal muscles. They are all skeletal muscles. So when they are contracting or relaxing too much, in both cases there will be the problem of respiration. And when the respiration is not proper one, there will be hypoxia, which will be shown or it will be seen as a cyanosis, that is bluish coloration of various body parts. Loss of bowel and bladder control, because skeletal muscle play a very important role in control of bowel, that is defecation and urination, and that control will be lost because of that, because it can causing too much contraction and relaxation of the sphincter muscles. It causes slow return to the consciousness. Post seizure confusion or fatigue can be there. If you know that while attempting very tough examination, the person goes into fatigue, mentally tired, or there is a confusion after that. So why? Because too much strenuous activity is there. So in that case same thing will be there. So confusion and fatigue can be there. So these all signs are there. We call it as a generalized tonic clonic, and previously it was called as a grand mal seizure. So this is a generalized seizure. It can be, actually we'll see that seizure has got around 40 types of varieties. Okay, and these 40 varieties are having very distinct features. So seizure can be blank staring, just staring, like many students in class, they do like that. They stare at a teacher like that, without any feeling, without any emotions, without any idea that they are understanding something. So this kind of thing is called as a blank staring. Then the movement, like chewing movements are going on, that even though nothing is there in mouth, but the jaws and the oral muscle will move in such a way that the person is chewing something. Then some other repetitive purposeless movement can be there. Wandering, confusion, incoherent speech. These are again some of the signs. In some cases it can be crying, screaming, running, then flailing. These are various things. Sudden loss of muscle tone and fall of the people can be there. Picking at clothes, disturbing. So this can be again a problem. Disturbing means own clothes are getting removed. So this is another type of there, we call it as a partial seizure, and it is known as a complex partial seizure. Why seizure is caused? What are the reasons? It can be because of many factors, particularly in infants because of the high fever it causes. Whenever there are some drugs like which are CNS stimulants, they can cause seizure. Alcohol withdrawal can cause seizure. The person is having lack of oxygen can cause seizure. So it can be during drowning, that is the person is drowning in water. During that, or means almost saved from that before death, these seizures can be there. Metabolic disturbances like either acidosis or alkalosis, systemic alkalosis, or changes in the ionic or ion and water imbalance is there when it is lost. Head trauma, that is injury to head, brain tumor, infection, stroke, these are some of the signs, some of the reasons. Complication of diabetes or pregnancy it can cause. Now we have seen seizures so far. Then what is epilepsy? Because many times we call it as anti-epileptic drugs. So what epilepsy is if seizure is different? So seizure is epilepsy is a seizure disorder. Means is the disorder in which seizures are repeatedly occurring. So it is a chronic neurological disorder which is characterized by recurring seizures that are not otherwise provoked by acute injury or health emergency. So when epilepsy is there, that is without any basic known cause, this is happening, these seizures are happening, we call it as epilepsy. So it is a common chronic neurological disorder which is characterized by unprovoked seizure. It is caused by sudden burst of excess electrical activity in the brain. It causes temporary disruption into the way the normal brain work. The disruption result into brain's message becoming halted or it becomes mixed up. What you experience during seizure will depend on there is where is in brain it is occurring. We have classified it on that basis, that is whether it is a generalized seizure or whether it is a this limited type of seizure, that is partial seizure. So there are many types of seizure, as I told you, there are more than 40 types of seizures, and therefore some drugs are working in one few types of seizure, they are not working in other type of seizure, and like that, vice versa. It can affect anyone at any time, because either it can be genetically, it can be hereditary problem, it can be because of some triggering events, it can be because of any environmental or such kind of factors. So it can affect anyone, but very important is not a contagious. So the contact with the person with epilepsy will not cause any other person to have it. Example, we know nowadays because of corona, we call corona is very highly contagious, and particularly the new strain which was found in Britain was more contagious. It can cause more infection to people, and therefore wearing mask, washing hands, everything is suggested. So if we compare like that, then this is not at all contagious, because even 10 people surrounding one person will have epilepsy, he will not have anything until and unless the person himself has got some other thing. There is no connection between epilepsy and intelligence. Actually there are many scientists or intelligent people, they have found to have means even though epilepsy was there, they are still well-known scientists. Then means epilepsy will not affect intelligence. But yes, if it is repeated, it is not treated, then the frequent epilepsy will affect various function of brain, including thinking, including the taking actions, and including responding, it can affect. So that way it can affect if it is not treated properly. Not all types of epilepsies are lifelong. 75% of the children either outgrow their epilepsy, means In childhood there is epilepsy, but when they become older one, then the epilepsy slowly goes out, or their epilepsy can be controlled with the medication when the medications are there. What are the causes, or what are the etiological factors? We have seen that we have seen some of the factors like trauma, hypoxia, alcohol withdrawal. So these are the identifiable causes, but 6 out of 10 they don't have any identifiable cause. Just like if you know primary, secondary hypertension, if you remember, primary means we don't have any reason, we do not know why it is causing. Similarly, it is 6 out of 10 people they cannot tell why there is epilepsy. Some this epilepsy are known cause, they are called as a symptomatic one. There are two main categories which are caused because of the brain injury or diseases, like maybe because of infection, brain tumor, trauma. Then stroke is one of the reason because it causes injury to the neurons, malformation or degeneration, metabolic disorders. These are the one reason, and another reason is hereditary factor. It can be inherited. In most people there is no family history of epilepsy, still it can be there. Genetic testing may help people if some genes are responsible for that, and it may be useful for the treatment, prognosis and genetic counseling. Now let us see the classes. As I told you, we have two major classes in which many are there. There can be mix of this also. We have got partial. Partial means, if you can see this figure, you will find that it is only specific areas of the brain they are involved into it, and most of the time it may be only one hemisphere can be involved into that, so we will call it as a partial one. While generalized, it means whole brain is there, from any hemisphere, from any portion to other portion it will go. So this is another one, is a generalized. In partial we have got three important groups or classes. One is simple. This simple is, this is happening, only EEG can detect, otherwise it will not be understood that the person has got attack of epilepsy or seizure, because just like we have seen staring like activity, just staring for a long period. Now in so much years of teaching, I have seen so many students staring like that, so we cannot say that this person has got epilepsy, because there are many students with blank face we can see, and they are attending classes, but we cannot say that it is a so it is persons are active, they are alert, and very minute this desynchronization or this neurological impulse firing is there, and it is so minute that it may not be even detectable. The person is working fine, no changes they are occurring in their activities, so is alert and can do all this activity. Another one is a partial, another type of partial is a complex. It is slightly more problematic than the simple one. That is, activity they will be changing. Maybe the sign symptoms are there, and it can affect some of the functioning of the person. So this is called as a complex. Next is a secondary generalized. The activity begins in one area, but it spreads to other. So from simple partial or whatsoever partial, it becomes generalized one. As we can see, partial is a very small area in the brain, while generalized means almost it is giving, or it is crossing the hemisphere of the brain. So this is secondary generalized. Initially partially remains to that area, but maybe it if treatment is not there, or if other provocation is there, it crosses the area and becomes generalized. Then generalized types, there are many. Absence, again staring and blinking is absent, because it is in both hemisphere it is happening. Myoclonic, it is a brief jerking movement, usually of upper body, these jerks are there. This is myo is a muscle, clonic means relaxation. Tonic clonic, going steep and falling, because body becomes steep. For that you should understand, or you should just go for the drugs acting on muscular system. You should know what the tone is, what is the tone, and what happens when the tone increases, when or tone decreases. If you know that skeletal muscle relaxants or So they are acting on both ways, on tonic way and clonic way. We have got a very variety of agents which are acting. So similarly, their tonic clonic actions are there. Without any drug, there will be increase in the body tone and decrease in body tone. And whenever tone is increasing too much or decreasing too much, it causes too many things. So it will be causing convulsions like jerking movements, and a person will fall down. The tonic means only stiffness will be there, falling will be there, but no clonic thing will be there. That is, person will not have any relaxation of that. Okay, so this the body will remain only in a stiff position. And atonic means falling limply to the ground, means not all of a sudden, or just gradual fall will be there to the ground. What are the primary treatment options? We know that various anti-epileptic drugs are there. You have studied it in earlier pharmacology. Only we have to select the best possible treatment. Then another thing is that surgery. We call it as ablation. Whatsoever portion is there that can be removed. If you remember ventricular arrhythmias, and you can just match with this. In arrhythmias also there are some places from which the excess of impulses are there, or they are responsible for desynchronization of these impulses, maybe because of bundle block, or maybe because of the circulatory system or whatsoever. So there are many reasons why there is ventricular arrhythmias are there. Similarly, these are the arrhythmias in the brain, because the synchronous impulses are there, and this will not be taking place. So what are the things which are available? One is anti-epileptic treatment. Surgery means that much portion which is responsible for that asynchrony is removed. Other treatments are vagal nerve stimulation, ketogenic diet, psychological, that is behavioral therapy, and complementary therapy. Some factors that can trigger seizures are, example, the person is diagnosed with the seizure diseases or epilepsy, and prescribe some treatment, but the person is keeping the treatment, then we call it as a relapse. Just now, if you see earlier in psychiatric diseases or even anxiety disorders, etc., when the medication is given for some time and the medication is skipped, then it can cause relapse of this. So the factor which can trigger it is mismedication, illness, infections like urinary tract, respiratory tract infections. Lack of sleep can cause triggering, or the epilepsy which was in control earlier because of medication or other measures. Because of all this, they will cause trigger. Okay. Many times we use the words like exacerbation of this. Exacerbation means which was either now not showing signs, or it is in a nascent condition, and because of that this is triggered off. Then heat, too much heat, boredom, getting bored and therefore thinking weird things, alcohol, photosensitivity, meals are missed. In that cases it will be there. Now how one can deal with this seizure situation? One cannot stop the seizure. Once that asynchrony is there, that will definitely happen. Until and unless you know that it is periodically happening and the treatment is given, then yes, you can control it. Protect the person from any real or potential damage. Now what are the real or potential dangers? The very important are two, if you can see from all previous discussion. One is what? The person falls down in some of the conditions. If falls down, then if it is falling down in very hard surface and it can cause injury, or any such portion which is a very pointed one, then it can cause injury, and that injury itself can be dangerous one, because again that injury can cause the seizures. So this everything can be increased too much. So this is what, or severe brain injury it can cause. Then or other injuries also. Then potential danger, another potential danger is, we have seen that during that, since all the respiratory tissues are respiratory important muscles are there. They are skeletal muscles, maybe intercostal muscle and diaphragm, like that. These all will have a problem, because we have seen during tonic, again it will not relax. We know constant relaxation of Contraction, relaxation of diaphragm and intercostal muscle is very, very important for, we call it as a pulmonary ventilation. So it will be affecting pulmonary ventilation, so it will cause hypoxia. Hypoxia we can itself trigger monic convulsions, and it can cause damage to other important organs also. If the person is injured, suppose person is falling down and the person falls on hand or something, then accordingly whatsoever, or there is a brief injury, then first aid should be given. How we are going to diagnose it? So we don't have simple tests like we have in cardiovascular system, that will go for CKMB or LDH etc., and they will show that there is a myocardial ischemia or like that. So we don't have simple such test which will be give the idea about it. But yes, we can have various tools we can use, like EEGs, MRI, blood and genetic testing. It can help to identify the type of epilepsy and possible causes. We can also have the medical history in detail, and the person who have seen the person falling or seen the what kind of sign symptoms were there, whether it was tonic, whether it was tonic-clonic, whether it was atonic, like that. So this type of sign symptom will give idea about what kind of activities were there. So we have seen earlier that epilepsy is not contagious. We have compared it with corona. It is not a mental illness. We have seen schizophrenia, we have seen depression, we have seen anxiety, we have seen bipolar diseases. So it is not like that, because here signs are visible. In that, many signs are not visible. It happens in the people. It is related to mind. Here it is related to function of the neurons. It is not a cognitive disability also. That is, cognitive disability means understanding or using the brain for some fruitful activity, just like memory and utilization of that memory for answering questions, solving problems, etc. I will call it as a cognitive. So cognitive functions are not there. Just now I told you that even very big researchers, Nobel laureate, like they were having problems of epilepsy, but it has not affecting their creativity or their science or their research or their knowledge. It is not a mental illness. Yes, but it can simultaneously, it can result into mental illness if it is continuously happening. Same thing if it is epilepsy is not treated, whenever it is occurring and the frequency is very high, it can also result into cognitive disability. As such, it is not. But if it is remaining uncontrolled, then it can convert into. The neurological dysfunction is seen in the epilepsy can begin at birth, childhood and adolescence, and even in adulthood. This can be there if it is not controlled. What are causes of epilepsy? It can be because of stroke, it can be because of the brain tumor, it can be because of brain infection, it can be because of the head injuries. Somewhere past it was there, although it was cured, but the internal injury has changed the anatomical features of the neurons and the various nearby structures. Because of the metabolic problem, I told you, hypoxia or hyperoxia or changes in the electrolyte and nutrition, etc. Other neurological conditions and genetic factors. These are the important causes. Epilepsy can also occur along with cerebral palsy. This is sort of malfunctioning of brain or underdevelopment of brain. Autism is also similar kind of disease, cognitive impairments like dementia, etc. Then attention deficit disorders, dementias, attention deficit hyperactivity disorder. So these are various things in which it is found to be having, or it is, these people are more prone to have epilepsies, it has been found. Or developmental disabilities, that is, brain structure is not properly formed, maybe because of any teratogenic drug or genetic changes or whatsoever it may be, but in that condition. But again, it can be emphasized that majority of people who have epilepsy will not have any other impairments and they will live a very normal life. It is not a big problem. Now let us see this. We already seen what happened. Generalized seizure, there is a electrical disruption which involve whole brain, means both hemispheres, as I told you, and area will be maximum. while in partial what will be there. So example of that is a tonic and clonic seizure, which was called as a grand mal. Here it is causing the loss of consciousness, fall and stiffening of the limb. It is followed by rhythmic shaking. Breathing may stop temporarily, skin, nails, lips may turn blue. Loss of bladder, bowel control may occur, generally lasts 1 to 3 minutes. If it goes beyond, then it can be more dangerous. It is followed by confusion and sleepiness because of the mental fatigue the person has got because of too much firing of impulses. In partial seizure, the electrical disruption, it involves only limited area of the brain. So we call it as a partial, and usually only one hemisphere. The simple partial seizure is having the rhythmic movements like isolated twitching of arms, face, legs. Sensory symptom like tingling, weakness, sound, smells, taste, feeling of upset stomach, visual distortions. These are the sensory symptoms. Psychic symptoms like deja vu. Deja vu is a sort of in anxiety, or we can call it as a panic disorder. That is, the person feels that there is no escape from the danger. It is going to cause a big harm to the person. When this kind of feeling goes, and then sort of hopelessness, no hopes, no saving can be there. This is called as a deja vu. Hallucinations are there. You know hallucinations now. We have seen it during schizophrenia. It can be visual, it can be auditory, it can be sensory, other sensory. So there are various kind of hallucinations can be there. Feeling of fear or anxiety can be there. The partial seizures usually last than 1 minute, and it may precede a generalized seizure. Just after that, generalized seizure can follow. Now complex is what? It is characterized by altered awareness, confusion, inability to respond, automatic purposeless behaviors like picking at clothes, chewing or mumbling. Emotional outbursts are there. All of a sudden person may try crying or like that. It may be confused with the drunkenness or drug use, because similar things are there. If you see that highly drunk person, and if they get emotional, they can start weeping like anything. They can cry loudly, and because so people may think that the person has drunk, or because of certain use of drug it can happen. We have seen various drug of abuse, we can say. This can cause, then it can cause willful belligerence or aggressiveness. What it is, a sort of whatsoever happen, I'll take care of everything. Whatsoever danger is there, I am ready to face. This type of activity is there. No fear of a situation, or actually one should have. सामने शेर आया है तो भी मैं बोले मैं जाके ये करता. I have seen various movies where heroes can beat any kind of lion or tiger. I am almost same like that. So this kind of belligerence or aggressiveness is there. So these are various anti-epileptic medications. You have studied all this in pharmacology. I'll need sort of brief information about this. Please take this as a homework. So what are these drugs are there, like valproic acid, felbamate, what are their mechanism of action, and what are their indications, in which condition, what are their specific adverse effects. So once we understand various drugs, then it will be easy for us to understand their pros and cons, and then we can select them in given conditions. So please go through pharmacology, which you have studied last year. Briefly you write mode of action of the drug, indication of the drug, in which conditions they are most preferred and they are not preferred, what are major adverse effects of these drugs. So this is all you have to put it on WhatsApp by before next class. Example of these drugs are like, as I told you, valproic acid, felbamate, tiazabine, levetiracetam, then lamotrigine, phenytoin, phenobarbital, gabapentin, carbamazepine, oxcarbazepine, topiramate, zonisamide, pregabalin, and many such. So these all drugs are there. Variety of drugs are there. There are many new also. how these drugs are functioning, what are their mechanism of action, and how these drugs are useful, in what condition they are useful, we'll know about it. Then we'll see all this medication, how they are working, and what are their details. So we'll see all this about various drugs and various guidelines, in what condition what drugs are to be used. Very important is there, we shall go for that. We shall see that initially, when it is not a severe symptom, only one kind of drug is basically prescribed. Same thing we have seen earlier in depression or schizophrenia, that initially started with one drug. Out of 3 4 first line drug, any first line drug is given in particular that condition, and then it is observed. If it is giving good results, it is continued. The repeated observations are made during a year or so, and then tapering can be done if everything is fine, if that condition looks to be resolved. If not, then either the drug was continued or new drug is to be added. So this is how various medicines are there. We shall see various medicines again, and accordingly we shall go ahead with various guidelines, what are the treatments. Just like, if you remember, you might have seen status asthmatics earlier, that is a very typical situation where sudden acute attack is there and which is not controlled by conventional treatment. Similarly, we have got status epilepticus, which is a very severe acute attack, and which is not controlled, particularly the regular medications. So I'll again suggest you go through status epilepticus also. So we'll go through this, and then we'll go for various guidelines in our next class. So already I told you, no big diagnostic features are there, because only EEG changes can be seen accordingly, and what pattern, at what place the changes are not normal. So that we can see, and on that basis what kind of drugs can be given in various treatments. So we shall see all this in next class. By the time you go through it, if you have any difficulty, you can ask, and just have the good reading or sort of homework on the basic pharmacology about various anti-epileptic drugs. So take care.